Hello everyone. Today we want to talk about the lung pressures that are present at the end of expiration and how these pressures prevent the occurrence of lung collapse. When we look at the lung at the end of expiration, and as we know at the end of expiration there is no airflow, and we know that the lung is composed of elastic tissue. This elastic tissue causes what we call elastic recoil pressure. This elastic recoil force pulls the lung inwards. So if there is no opposing force to this elastic recoil, the lung will collapse. But the lung is present in a chest wall, and this chest wall has the capacity to expand outward and anteriorly. And so we have two forces. One force is pulling the lung inwards, and this is the elastic recoil, and another force that is pushing the lung outwards, and that is the elastic recoil of the chest wall. And these two forces are in balance, and due to this balance the lung will not collapse. Due to the presence of these two opposing forces, the one that pulls the lung inwards and the other one that pushes the lung outwards, due to this a space is created which is the pleural space. The pressure in the pleural space is a little bit lower than the atmospheric pressure, and so we call the pressure that is present in the pleural space a subatmospheric pressure. The atmospheric pressure is 760 millimeter mercury, and the pressure in the pleural space is a little bit lower than that. This pleural pressure is lower than the atmospheric pressure, but it still has the capacity of pushing the lungs inwards, so it may lead to the collapse of the lung. So now we can say that there are two forces that may cause the lung to collapse. The first one is the elastic recoil, and the second one is the intrapleural pressure. What prevents the lung from this collapse is another pressure that pushes the alveoli outwards. This pressure is the alveolar pressure. So the alveolar pressure is an outward force that pushes the lung outwards. And this alveolar pressure is in balance with the elastic recoil pressure and the intrapleural pressure. And so, in case of equilibrium, when there is no airflow into the lungs, when the lung size is stable, we can say that at this point, the alveolar pressure will be equal to the elastic recoil pressure plus the intrapleural pressure. We can change in this formula and say it in a different way. We can say that the alveolar pressure minus the intrapleural pressure is equal to the elastic recoil pressure. Of course, this is, as we said, in case of equilibrium when there is no airflow into the lungs. But when the patient takes breath, of course, these mechanics will change. The alveolar pressure minus the intrapleural pressure has another name, which is transpulmonary pressure. What is the importance of this transpulmonary pressure? We have said that the alveolar pressure is an expanding force that pushes the lung outwards, whereas the intrapleural pressure is an inward force that pushes the lung inwards. And the transpulmonary pressure is the difference between these two pressures. It is the alveolar pressure minus the intrapleural pressure. This means that when we find that the transpulmonary pressure is increased, this indicates that there are more expanding forces in the lung and that the lung size is increased. Whereas when the transpulmonary pressure is decreased, this indicates that there are more collapsing forces in the lung and that the lung size is decreased. So increasing transpulmonary pressure means that there is lung inflation, whereas decreased transpulmonary pressure means that there is lung deflation. The concept of inflation and deflation does not necessarily mean that there is airflow going inside the lung or coming out from the lung. It simply means that the size of the lung is increased or decreased respectively. Now, let us look at this formula. Transpulmonary pressure equals alveolar pressure minus intrapleural pressure. And let us ask ourselves, what will cause the transpulmonary pressure to increase? And simply by looking at this equation, we will figure out that the transpulmonary pressure is increased if the alveolar pressure increases or if the intrapleural pressure decreases. Whereas the transpulmonary pressure is decreased when the alveolar pressure decreases or when the intrapleural pressure increases. After talking about the lung pressures at the end of expiration, we want to learn another concept, which is Boyle's law. If we have a balloon that contains a specific amount of air, if this amount of air remains constant without any change at a constant temperature, then increasing the size of this balloon will lead to a decrease in the pressure inside this balloon, and vice versa. If we decrease the volume of this balloon, this will lead to an increase in the pressure inside this balloon. If we want to make Boyle's law applicable to the lung, meaning if we try to expand or increase the size of the lung, this means that the pressure inside the alveoli will decrease. This is exactly what we said in Boyle's law, taking into account that the amount of air is constant and the temperature is constant. And vice versa. If we decrease the size of the alveoli, this will lead to an increase in the pressure inside these alveoli. We want to learn another concept. We need to know that the air or the gas flows from the high pressure to the low pressure. So during inhalation, the air flows towards the lower pressure in the lungs, whereas during exhalation, the air flows from the higher pressure in the lungs to the outside of the lungs. Till we meet again in another lesson, thank you.